I'm Michael, and this is California. And right now, with the resurging pandemic and the continuing aftermath of the first wave of the pandemic, it would really seem like an unlikely time to try to get rid of one of the biggest ways that Americans get their health coverage. In addition to the fact that 30 million people are losing their work and subsequently losing their health coverage through their work, there really could not be a worse time to try to get rid of the Affordable Care Act. Now, despite all that, the Trump administration has joined a bunch of red states to try to put an end to Obamacare once and for all in a court in Texas. And these efforts, despite being totally oblivious to the health pandemic that's going around the country right now, seek to obliterate the Affordable Care Act and, worst off, really leave nothing in its place. So today we're going to discuss one of the most recent attempts by the White House to dismantle, disengage, and destroy the Affordable Care Act and what that could mean for folks who are currently on the health exchanges. Now, before we do that, if you like this information, if you find it interesting, if you find it helpful, please don't forget to like and subscribe. That way you can get updates when our newest and most informative videos become available. So let's do a quick recap of Obamacare. So the Affordable Care Act, or Obamacare, created a health exchange that provides full access to health coverage through private health insurance companies to really anybody who's lawfully present in the United States, regardless of their income. It provides comprehensive coverage, including maternity coverage, drug rehab, and they cannot decline anybody for their previous health conditions or pre-existing conditions. And for folks who fall within the income guidelines, the health exchanges provide subsidy or premium assistance to help ensure that the healthcare costs are low and affordable. Now, across America, pre-pandemic, the Obamacare exchanges had nearly 20 million Americans in them. And there are not any federal numbers yet to see what the change has been as a result of the pandemic, but here in California, there's been around an 80% increase from the same time last year in folks enrolling into the exchange. So last year, there's 135,570 Californians who had enrolled, and now there's 242,600 Californians who enrolled as a result of the pandemic. So really, the success of these health exchanges has been a thorn in the side of President Trump, who ran his campaign on the abolition of the Affordable Care Act. And the Trump administration has really been attempting to undermine the health exchanges since the very first day he started running for his campaign. But this Thursday, amid the growing second wave of the pandemic, the White House has asked the Supreme Court to invalidate the Affordable Care Act and in turn shut down the health exchanges that provide millions of Americans with health coverage. The White House argues that because the individual mandate has been set to $0, well, at least federally. So here in California, we still have the minimum tax penalty of $695 per person who doesn't have health insurance throughout the year. But with a zeroed out federal tax penalty, it claims that without the effective tax in place, then the coverage requirement is unconstitutional, which also makes the rest of the ACA unlawful. Luckily, so far, constitutional lawyers on both sides of the spectrum widely see this reasoning as not to hold much water. It is really labeling it as implausible, hard to justify, and surprisingly weak. And the reality is, this just might be an attempt by Trump to try to regain some of the ground he's been losing to Biden in his campaign after he's been seen as mishandling the pandemic and the crisis. Now, although this case is on the docket to be heard by the Supreme Court in the fall, it's unlikely any decision would come out until well into 2021. And really, until then, a lot can change, primarily in the case where Trump is able to replace another Supreme Court justice. And if that happens, implausible or not, the White House could actually overturn the ACA. Now, almost as a way to troll the White House, Nancy Pelosi and House Democrats released the Patent Protection and Affordable Care Enhancement Act on Monday. And this bill is designed to strengthen and expand upon the Affordable Care Act and fix some of the long-standing Medicaid issues and lower prescription drug costs. And some of the key ways the bill would strengthen the existing ACA is that it would allow households to actually make more money and still be able to get some financial assistance. It would also eliminate a rule that disqualifies families from help if they have health insurance offered to them through their work, even if it's prohibitively expensive. Now, realistically, this is not likely something that's going to pass with the Senate and the White House in Republican hands. It is probably just a very obvious way for the House Democrats to make a point by juxtapositioning this new bill with the actions and intentions of the White House. But it is good to see that at least both sides are still thinking about healthcare amongst all this other chaos. Overall, it seems like very strange timing that the Trump administration is choosing to attempt to further sabotage the Affordable Care Act in the middle of a health pandemic, especially because there isn't any other better options that are being offered. It would be very short-sighted to get rid of a program that assists so many Americans in the middle of a pandemic and have nothing to replace it with. But if they are successful, I know for sure that my job will be a heck of a lot busier trying to ensure that all my clients who have major health issues can try to get coverage that they need to stay alive. I just hope that Mr. Trump thinks twice about this decision, because the reality is, even if the White House was successful to overturn the ACA, is this something that either Republicans or Democrats or even Americans overall would really want? I don't think so. Thank you so much for watching our videos. I hope that you found it interesting or helpful or at least useful. And if you did, please don't forget to like and subscribe. That way you can get updates when our newest and most informative videos become available. Also, if you have any comments or questions, leave them down below. We love to see your comments and questions, and we'll be happy to make a new video or a new post as soon as we can. Now finally, we here at California, we know health insurance. So whether it's private health insurance or Covered California or Medicare or Medicaid or Medi-Cal or even health insurance for a small group, we know health insurance. Because I know it can be very complicated coming out of your work insurance and having to go onto private health insurance. Or maybe you're turning 65 and you're trying to figure out what are the best options for your Medicare, the ones that fit your needs as well as your budgets. We can help with that. And also, you may be coming out of a government program like Medicaid or Medi-Cal and having to get health insurance on the private side. We can help with that as well. So if you have questions about your healthcare, put them down below. We'll be happy to make a new video or post for those as well. Now, other than that, I'm Michael, and this is California, wishing you a happy, healthy day.